Okay, well, on to the fetal stage. So beginning week 9 of prenatal development, and this will go until birth, so approximately 29 or 30 weeks. And the focus here is rapid growth. We've gotten everything in position, believe it or not. You look like a little tiny human when you start into the fetal stage. Of course, nothing is functioning like it will eventually, but it's not even going to be functioning at birth. So we've got time. So, but you have to become bigger so that you can support yourself outside the body and then continue developing as well once you're born. So we have an enlarged head and very short limbs, so this is going to change so that you are more proportional. And we're going to see the conversion of all this cartilage that is giving you your shape right now, in the long bones and the skull and so forth, into some of it into bone. And of course, ossification isn't complete until your second or maybe even third decade after you're born. So, got a ways to go. You will also be able to tell what sex your child is, boy or girl, during this time, because up until this point there isn't anything evident unless you had chromosome work done so you could actually see what the chromosomes were, XX for females and XY for males. You would just have to wait. So generally people discover the sex through ultrasound, and you can do that because of this process shown here. So up until this point, right, in the embryo, this is what the reproductive system looks like. All right. So what's going to happen is, I say here, that in the male, the gonads, of course, become the testes and epididymis, and the Mullern ducts degenerate, and the Wolfine become the vas deferens. So there's kind of a switch, basically, here, right? In the female, the gonads become the ovaries, and the Wolfine ducts degenerate, right? While the Mullern ducts become the uterine tubes and uterus. So choices are made as genes turn on and off, right? And current contemporary science says that the stimulus for this, of course, is due to genes present on the Y chromosome, and that female sex is actually the default, right? If you don't have the Y chromosome, you automatically become a female. So, of course, as development continues, the testes will descend down into the scrotal sac. But here again, we're just looking at the early development, differentiation of male and females. The testes enlarge in the females, and the ovaries stay small. All right. This is something that, let me take this over here a little bit, that we do discuss in lab, and that is some of the changes in fetal blood and circulation. All right. So a nice cartoon here. So here again, here's our chorionic villi and maternal blood. Here we get nutrients and oxygen coming in through the umbilical vein. All right. And all of this, of course, was established by the developing embryo and fetus now in a fetal stage. So as that blood comes in through the umbilicus, the first place it would go is the liver, as I show you here in this little cartoon. So blood coming in through the umbilical vein would typically, and any blood coming with nutrients would typically go into the liver first. So this would be the hepatic portal circulation, basically. And but the liver is not functioning in the capacity it's going to after birth, so we don't need to send all that blood there first. Why? There's other cells in need. So this little tube is called the ductus venosus because it's between the hepatic vein, portal vein, and the inferior vena cava. So only a little bit of blood moves into the liver, enough to keep those cells alive and growing. A lot of the blood moves directly into the inferior vena cava, and this, of course, will go away after birth. All right. The blood continues on through the inferior vena cava into the right atrium, just like it does for us. And here's the superior vena cava coming in. So in us, of course, adults, the right side is completely separate from the left, but it doesn't have to be and wouldn't be here in a fetus. So there is actually an opening between the two atria, all right, and this opening is a foramen, and it's shaped oval shape, so it is the foramen ovale, and this allows this blood from the right side to go directly into left systemic, bypassing the lungs. Now, some of the blood does move through the tricuspid valve into the right ventricle and then out through the pulmonary artery, but it turns out there's another difference here in the fetal circulation between the pulmonary artery and the aorta. So this short tube is another duct, and since it's between two arteries, we call it the ductus arteriosus. And this further bypasses the lungs. So again, lungs after birth would have to get about 50% of the blood returning to the heart, as we've explained in the cardiovascular chapter. But here that is not the case, because the lungs are collapsed and they're not being used. As soon as the lungs are inflated, this will all change pretty quickly. All right? So again, we don't need blood going to these organs, and so we have modifications to circulation. All right? So this just goes through what I've already said, the bypassing liver through the ductus venosus. So there isn't just enough blood to keep the liver alive, right? We bypass the lungs since they're non-functional using the foramen ovale between the atria and the ductus arteriosus. All right? I say, just to let you know a little bit about development here, but I am not testing on this. I go through some of the changes and how we proceed. And we generally look at this from week to week, these amazing changes that go on and things that really excite us, especially that starting to feel the movement. That's a really cool thing, right? And baby or fetus will continue to kick and grow and change up until the point of birth. And then, of course, after birth, we just keep on changing. Maternal changes, yes. So during the pregnancy, right? So here we have a fairly early embryonic, or maybe a late embryonic baby, right? So surrounded, we've got the amnion and the chorion are fused, so amniochorionic membrane here, placenta here, umbilicus there, and we're starting to see enlargement in the uterus, and we're just going to keep on seeing that, right? So end of the first trimester, which is, again, you're moving into the fetal stage. And we're just going to really expand when we're in the fetal stage. So I said, trimesters are typically about 13 weeks apiece, because I said it's about a 39-week gestation for us as humans. All right? This growing fetus just is going to cause this expansion. The uterus will keep enlarging and thinning. Amniotic fluid is filling there, breasts enlarge, and the placenta is growing, so you do see a subsequent weight gain in the pregnancy. And of course, mom is processing baby's blood as well, and baby just keeps on making more and more blood. All right, hormones, so maternal changes in our hormones. I said in the first 10 weeks, right, so through the embryonic period, the corpus luteum is functioning and secreting the estrogen, progesterone, relaxin we talked about. After this period, the placenta needs to be ready to take over, and so continues making estrogen, which did everything we talked about before, inhibits FSH and LH, so you don't have another ovulation, right? Induces the growth of fetal tissue, so estrogen is anabolic, it's promoting the growth of the baby. The maturation of lungs and liver in your growing fetus. Regulates progesterone and triggers fetal cortisol. This is going to be very important when it comes to parturition or labor, right? And helps to enlarge the uterus, right, because it needs to keep expanding, and the mammary glands. Relaxin, we said, increases the elasticity of the symphysis pubis, right, and the pelvic ligaments, so we can spread. The pelvic girdle can expand for a vaginal delivery, and relaxin will help us with cervical dilation. Progesterone will suppress the LH and FSH as well, so it also helps estrogen to keep you from producing more follicles, and is inhibiting the uterine contraction. So we call this the uterine quieting hormone. All right, so here's a quick look at the levels of hormones in mom's blood. So I say here that the mom's anterior pituitary increases the thyrotropin, so her metabolic, right, this is going to target the thyroid and increase her metabolism so she can help fuel this growth. It's going to, the anterior pituitary is going to be producing prolactin, but not releasing it. And the adrenocorticotropic hormone, which, and I said, this is also going to help us with stress hormones to delegate where energy goes. So overall, mom sees an increase in metabolism. Her breasts are being prepared for lactation, and these, right, especially this cortisol, is helping drive the fetal protein synthesis, so that the fetus is more effective at making its own molecules. Parathyroid hormone increases to provide calcium to the fetus as well. So On this chart, again, all you see is the levels of estrogen and progesterone staying high in the pregnancy, whereas, again, the human chorionic gonadotropin is going to drop off after about week 10 or 12, because the corpus luteum is not required anymore, and the chorionic gonadotropin had actually supported and rescued the corpus luteum. All right, changes in your organ systems. So in the digestive and urinary, and again, these are pretty common sense, right? Nausea or morning sickness is generally related to the increasing hormone levels, especially estrogen and progesterone, but HCG is known to cause a lot of this. And there's a decreased motility, so you get constipated. Right? So we basically say eat prunes or eat some, right, a lot more fiber to hopefully help with motility. Growth of the uterus can displace those organs and disrupt your meals, so heartburn is not uncommon. And of course, as the uterus expands, it's going to put pressure on the urinary bladder, right? And you're also processing more and more fluids as that baby grows. Circulatory system, right, absolutely increase in blood volume. And this is basically due to, again, you are now processing all of the growing fetal blood as well, because fetus can't do that. Right? You can circulate it, but it can't take care of delivering waste or delivering nutrients and removing waste. So it just gets it to the placenta, and then that volume crosses into mom. Okay, so blood pressure goes up, heart rate goes up, and we just watch carefully that it doesn't go too high. Compression of those pelvic vessels help to lead to hemorrhoids, which is, again, complicates this whole, you're now compounding, the problems you're having with digestive system as well. All right, so respiratory, more oxygen is needed, especially towards the third trimester. And, you need it in the beginning as well, but as that baby continues to grow, or the fetus continues to grow, you're going to need to have more and more energy. So breathing rate increases, and while this uterus is expanding, it would diminish your ability to breathe deeper. So you have to compensate with faster respiration. All right, and then the integumentary system, your skin, the dermis stretches and can tear, so stretch marks. Right, there's an increase in melanocyte-stimulating hormone, so you get darker areas of the skin, including sometimes women present with what we call a pregnancy mask. All right, so pregnancy terminates with a birth process called parturition. So that's the name for labor, right? In the 8th month of the pregnancy, all right, when we talk about, again, the 9-month pregnancy, the trimesters, fetal cortisol rises. So we're not seeing this on this chart, but this is a definite. So fetal cortisol, its stress hormone, begins rising. You're running out of space and amniotic fluid. So I'm sure that the fetus is experiencing a low level of stress. So estrogen continues to rise, as we see here, right? And progesterone will start to decline. Because remember, this was quieting the myometrium. So this ratio of estrogen to progesterone increases and sensitizes the myometrium. All right? The posterior pituitary starts secreting some oxytocin, and the myometrium develops more receptors for oxytocin, so oxytocin is more effective. As oxytocin increases, it stimulates secretion of prostaglandins from fetus, and the fetus also produces oxytocin to help with the progression of labor. So this is what we talk about are the 3 phases that the cervix has to dilate to allow the baby to pass, and then you have to expel the fetus, and then you have to expel the placenta. So we talk about 10 centimeters, and this takes a while, right? Uterine contractions help to stretch the cervix, and again, the baby's head would be positioned to hit the cervix. And as it stretches the cervix, more oxytocin is released. So this is why we talk about positive feedback here. So the more stretch that occurs, the more oxytocin. So contractions become stronger and closer together. Expulsion starts as the fetal head enters the vagina. All right, so here we go. And ends with the freedom of the child, right? So here we go here. You have to aspirate the mucus from the nose and mouth, and then clamp the umbilicus, and that has to happen right away for success. And then the afterbirth, well, this is the placenta being expelled. And it marks the beginning of postpartum, which will be 6 weeks. Yay. After this.